Our topic today is hair and scalp disorders and diseases, part 1. Students, this will resemble your notes that we've taken in class. Our learning objectives will be explain the importance of understanding hair and scalp disorders and diseases. Number 2, explain the causes of the most common types of hair loss. The essential question for the entire chapter is, why is it important to recognize hair and scalp disorders to prevent and manage them effectively? Why study hair and scalp disorders and diseases? To recognize what is treatable by a cosmetologist and what should be referred to a health care provider. You should have a thorough understanding of hair and scalp disorders and diseases because you need to be able to identify the difference between common and irregular hair loss, helps better recommend client hair loss treatments, recognizing scalp and hair conditions, as well as when a client should be turned away and referred to a physician is a part of infection control duties. As a cosmetologist, you will often be the first resource for clients to help them distinguish between common and irregular hair loss. For example, hair shedding is a natural part of the hair's growth cycle and is common to 50% to 100% hair loss per day. But there are some conditions that can cause irregular and even significant hair loss. Androgenic alopecia. Androgenic alopecia is also known as anogenic alopecia. This is the hair loss characterized by terminal hair miniaturization and shortened anagen phase. It can affect anyone and is caused by genetics, age, or hormonal changes. Androgenic alopecia can begin as early as the age teenage young years and is frequently seen by the age of 40. According to the National Center of Biotechnology Information, it says by the age of 50, almost 50% of the men experience some degree of hair loss. According to the U.S. National Library of Medicine, approximately 30 million women experience hair loss commonly after menopause. Androgenic alopecia is also known as male pattern baldness, affected when experience thinning and or baldness that generally has a horseshoe shape. Women with androgenic alopecia rarely experience pattern baldness. They typically experience a generalized diffuse thinning over the crown, top of the head, and temple areas. Now we're going to cover your alopecia areata, which have two categories, alopecia totalis and alopecia universalis. Alopecia areata is an autoimmune disorder. The way you remember the alopecia areata is in my area. In my area means that the immune system attacks the hair follicles, which leads to hair loss in round or irregular shapes. Again, areata is my own autoimmune disorder that I have. It is attacking my immune system. So I am attacking myself. So alopecia areata is in my own area, within myself, which causes hair loss in round or irregular shaped patches. The white blood cells stop the hair growth during the anagen phase, which causes the hair to enter the telogen phase, which means it skips the canagen phase. 6.8 million people in the United States are affected by alopecia areata. Remember, in my area, autoimmune system is being attacked. It is attacking my hair follicles during their lifetime. The scalp appears normal in the areas of the hair loss. More advanced forms of alopecia areata includes alopecia totalis and alopecia universalis. Alopecia totalis is the hair loss of all terminal hair, scalp hair, which should be on the scalp, all of the terminal hair on the scalp. Alopecia universalis is the loss of the terminal hair on the body and the scalp. On the body and the scalp is for your universalis, and totalis mean the scalp on the head. Alopecia areata occurs in people of all ages, sex, race, ethnic backgrounds, and some most often begins in childhood. The scalp usually shows no obvious signs of inflammation, skin disorder, or diseases. Postpartum alopecia is a temporary hair loss after pregnancy. Most people experience temporary hair loss 1 to 5 months after pregnancy. A higher number of hair enters the telogen stage, which causes the hair loss. Typically, the cycle regulates within 6 to 12 months. Hair loss treatments. Your hair loss treatments is going to be minoxidil and finasteride. Hair loss treatments. They are two Food and Drug Administration, FDA, which approves the products in the United States proven to stimulate hair growth, minoxidil and finasteride. Minoxidil is a topical medication applied to the scalp. It has been proven to stimulate hair growth and comes into two different strengths. 2% minoxidil is your regular strength solution. 5% minoxidil is your extra strength solution. Rogaine, Rogaine is the most well-known minoxidil product. Finasteride, an oral prescription medication. Finasteride is more effective and convenient to take than minoxidil, but it may have negative side effects, including birth defects in a male fetus, and therefore is not prescribed for people with childbearing potential. These medications slow the rate of the hair loss, and some users even experience hair growth. It may take several months of use to see results, and the benefits end when an individual stops using the products. There are surgical options available. A hair transplant is the most common and permanent hair implant technique. These processes consist of removing hair follicle from one or more areas of the head and transplanting it in the area desired. These transplanted follicles grow typically in the new location. Cosmetologists can help clients with non-medical options such as wigs, toothpaste, hair weaving, and hair extensions. The emotional impact of hair loss. About 80 million people in the United States experience hereditary hair loss, with multiple studies linking hair loss to lower self-esteem and lower confidence. You need to be aware that this is a sensitive topic that clients may be hesitant to talk about. You are in a unique position to help your clients develop a plan to address their thinning hair. Having a strong understanding of hair loss types, current products and treatments available, and what falls within a cosmetologist's scope of practice in your state will help you serve as a resource for your clients. Medicine and surgical procedures are the only proven treatments for hair loss. Your role is to help clients determine if their hair loss is typical or potentially concerning, and advise them on when to seek the help for a hair care provider. For a healthcare provider, which may also use to say doctor or refer to their physician or seek medical attention, or as this ending statement says, healthcare provider. Seek healthcare provider. Did you know? During your career, you may have clients express concerns about thinning hair or hair that does not seem to grow. Several internal and external factors affect hair's health, including nutrition, hormones, and styling. The body supplies nutrients to the organ first, following by the muscles, the bones, the tissues, and lastly the hair. As well as a balanced diet provides enough nutrients for your hair as well. The hair follicles take 3 months to regenerate. If you start a supplement regimen or improve your nutrition, it will take 3 to 4 months to notice the hair and the healthiness or the growth change. Androgens and testosterones and thyroid hormones affect thinning hair as well. Androgens, including testosterone, affect the dermal pili and production of keratinocytes, which leads to the hair follicle maturation and affect the hair growth. Insignificant thyroid hormones and metabolic disorders may also cause thinning hair. Damage from styling also hinders hair growth. Your knowledge of hair's structure and what causes the damage. This concludes our chapter on hair and scalp disorders and diseases, part 1, with emphasis and focus on alopecia, which is also known as hair loss.